So why do you need your wisdom teeth out? What we know about wisdom teeth are there are lots of problems associated with wisdom teeth. The biggest problem is it can affect the health of the other teeth. And many times it's the tooth adjacent to the wisdom tooth, but actually some more recent studies have shown us that it actually goes much further than that. The first statement was, if you have your wisdom teeth by age 30, then you are twice as likely to develop gum disease than if you don't. The second item from that big study was that if you have your wisdom teeth by age 40, then you have a 40% chance of having a cavity on the wisdom tooth, which is bad because you will lose the wisdom tooth, but also you have a 40% chance of having a cavity on the tooth in front of it. What we see is that cavity is not normally where a cavity would be on the top of the tooth. The cavity typically is lower down on the tooth, at the neck of the tooth when the tooth is impacted, and usually means when you get a cavity down low on the tooth in front of it, you're going to lose the tooth in front of it. But I gotta tell you, as an oral surgeon, we see problems with wisdom teeth every day in practice, every day. So the fact that someone has a wisdom teeth that doesn't have a problem, yeah, that does exist, but for the most part, on a daily basis, we see a problem. So the current recommendations are to get your wisdom teeth out before you have a problem, typically if they're impacted, typically if they meet a certain set of criteria, but ultimately it's a very routine thing in this practice. If you want to learn more about wisdom teeth and want to find out if you are a candidate for removal, call us, set up an appointment to come see us, and we'll get you on the right path to health.